Hello and welcome to Communication Between Cultures, Chapter 10. And in this portion of Chapter 10, we're going to be talking about the cultural influences and intercultural communication practices in the healthcare setting. So, why is understanding intercultural communication in the healthcare setting important? While we have much of the same types of problems within the healthcare setting as we do in other types of settings, the possible result of poor communication in the healthcare setting can be very serious. If communication between a patient and a healthcare provider is not clear, serious mistakes can be made in diagnosis and treatment, and those mistakes can lead to the difference between life and death. So, while in the educational setting or in the business or professional setting, we may be dealing with important things such as losing a business deal or losing the attention of a student or the potential of a student. In this case, we're talking about life and death, which makes it actually, I think, in many cases more serious than in the other situations. Now, the second question is, why are we studying healthcare specific concerns in a non healthcare class? True, this is not a healthcare class. However, healthcare or a person approaches healthcare doesn't just affect their situation with their doctor or their nurse or other types of healthcare providers. A person's healthcare choices affects the choices that they make throughout their life, whether they choose to eat certain foods or go on certain vacations or engage in certain activities. And these are going to be things that people are going to be doing around you, right? These are things that you're going to be able to need to understand and to understand why people do things the way they do, why maybe they eat what they eat. This is something that is pervasive to their entire lifestyles and not just the choices in the health or in the hospital or in the doctor's office. So first we're going to talk about what we're going to call healthcare belief systems. A person's healthcare belief system is a type of cultural worldview that affects how members of that culture approach their healthcare, how they recognize their illness, to what they attribute the illness, how they feel they got sick, why they feel they got sick, and how then to treat that particular illness. What's going to make them better? Healthcare belief systems can be divided into three major categories, and the first that we're going to talk about is the supernatural Magico religious tradition. In the supernatural Magico religious tradition, the underlying premise is that the fate of the world and those in it are generally determined by the acts of some kind of supernatural forces, both good and evil supernatural forces. So the causes of illness then can be attributed to punishment for wrongdoing by those supernatural forces, or perhaps even possession by evil spirits. The evil eye is one of the oldest and most widespread superstitions regarding illness. There are lots of different interpretations of the curse of the evil eye and how it can be used and who can give it. Sometimes many different cultures interpret the story differently or interpret the superstition differently, but generally speaking, the evil eye can be given by someone who is jealous of you or someone who doesn't like you or someone who wishes you ill, and that can be a cause of illness. Now, to most of us living in the modern world, we generally think of the evil eye as being something that is a thing of the past, right? An idea or a belief that only old people might really adhere to, that modern people don't adhere to this type of superstition, at least not modern educated people. But you would be very surprised. When a person is ill, they are likely to revert to things like these types of superstitions, even if in a different time and place they may not. Let me give you an example. Many years ago, uh, I was visiting a friend of mine. She was my ex-husband's cousin. He wasn't my ex-husband at the time, but okay, my husband's cousin at the time, and she was about to have a baby. So we were there for the birth of her baby. After her baby was born, she got very sick and frankly almost died. And her mother, from what I understand, convinced her that one of the reasons that she was sick, if not maybe the only reason that she was sick, was because I gave her the evil eye, because she had had a boy and I had recently just had a girl. In their culture, having a boy was preferred. In my culture, it wasn't so much preferred, but so this was very shocking to me. I couldn't believe that they would actually think that of me, but they, or even that they would think about that even as being a possibility. And one thing I can see, her mother is kind of an older, more uneducated individual, but she is a very educated person. In fact, she is a doctor, a psychiatrist, even. So for her to believe that was very shocking to me. But she did, and I understand why. Because again, she was scared, and she was tired, and she was, easily influenced by ideas such as this, that maybe in another time and place she would not have even entertained the idea. And she was a very nice person. We were actually good friends, and have always been good friends even since that time period. But when somebody is sick, you'd be surprised what they might believe. All right, treatments in the supernatural Majiko religious tradition are often carried out by some kind of a spiritual healer or a shaman. I know when we tend to think of a shaman or a spiritual healer, we often picture somebody dancing around a fire with lots of feathers, or crazy masks, or whatever. But honestly, when we're talking about the supernatural Majika religious tradition, we're not just talking about those types of spirit healers. We're talking about ones that are going to be much more common and much more maybe recognizable to you, like rabbis and priests and imams and ministers. All right, people that you know and interact with on a daily basis. Those are spiritual healers as well. The goal is to achieve a positive association with whatever spirit or deity either making you sick for whatever reason, or has perhaps the power to make you well. And sometimes can be accomplished by removing the harmful stuff, spirit stuff from the body, in almost a type of spiritual surgical type of procedure in some cultures. Some cultures often look to animal spirits for help from the cosmos. A good example of that, if you have ever seen the Disney movie Brother Bear, we see that kind of spiritual healing mindset there, where they elicit the spirits from, or the help from animal spirits in order to help them with whatever's going wrong with their lives, including medical illnesses. The next tradition we're going to talk about is the holistic tradition. The underlying premise of the holistic tradition is that an individual as a whole is made up of interdependent parts: the physical, the mental, the emotional, and the spiritual. If something happens to one of these parts, then all of the parts are going to be affected. So the main premise of the holistic tradition is balance, always maintaining a balance within yourself. The cause of illness is falling out of balance. If you want to remain healthy, one must remain in harmony with the laws of nature and adjust easily to differences in environmental changes and life changes. If we fight those changes, then we're going to throw ourselves off balance. This is one of the reasons Asians would believe that they cannot control their environment but must adjust to it. They tend to be more easily adjustable to changes in their environment because of this supernatural, or rather this holistic ideology of balance. It's not just the Asian cultures, however. We see that in Mexican and Puerto Rican cultures, we have this concept of humors in the body, whereas different parts of the body are considered to be hot and or dry or wet, or cold and hot, or dry or wet. And any imbalance of these four humors of the body can cause illness. American Indian tribes believe that the human body is one with the earth, and any harm done to the earth can cause an imbalance between humanity and the nature of the earth, and that can cause illness, even if it's not something that you did specifically, but something that your people did or something that happened in the past or even may happen in the future. When talking about the treatment of illness in the holistic system, we often look first to the Chinese holistic medicine. Chinese holistic medicine has been around for thousands of years and has had wonderful success. Is actually practiced all over the world and not just in China. Uh, as a result, the Chinese are likely to put a great deal of emphasis on their holistic treatments and their traditional treatments, and often are likely to self medicate if they think they know what's wrong with them. They may also consult with more spiritual healers or fortune tellers to try and determine optimal dates for medical procedures to make sure that they're doing things at a time when it is most beneficial, cosmically speaking. They believe again in the balancing of the yin and the yang, or the cold and the hot elements of the body. Any time that you fall out of balance is when you're going to be ill. Um, we we often fall, like I said, Chinese medicine isn't just for the Chinese. The Americans often use Chinese medicine. In fact, there are many types of Chinese holistic procedures that you may be very familiar with, such as acupuncture, which is a procedure done with needles used to cure disease, pain, even psychological conditions, and has a great deal of success. Moxibustion, which is a therapy involving heat, herbal remedies such as ginseng or other types of herbal tea. Uh, Many of you probably use herbal teas in order to relax or to be able to go to the bathroom a little bit better, or maybe to sleep a little bit better for many different things, and that's a holistic medication, a holistic type of medical treatment. Certain exercises, such as Tai Chi or yoga, also come from this part of the world. Mexicans, again following with that idea of the four different humors of the body, will often seek to locate imbalances within that person's relationship with the environment. Sometimes it has to do with their emotional state. Sometimes it has to do with what's going on in their lives. It's not necessarily just all physical. But those things will affect the physical factors. So they're going to look at that person's entire life situation to try and figure out how to treat that illness. Oftentimes, they will, like we said before, attribute certain elements of the body as being either hot or cold or wet or dry. They'll also attribute certain foods and herbs to be as either hot or cold or wet or dry, and foods, and illnesses as well. So, for example, if you're going to have like a hot illness, you're going to maybe eat a cold food to try and balance that out and bring your body back into balance. The next type of healthcare belief system that we're going to discuss is this one that you're probably most familiar with, and that is the scientific biomedical tradition. The underlying premise of the scientific biomedical tradition is that there's a scientific explanation of disease and human health, and that this can be understood through understanding different physical and chemical processes within the body. This system often rejects the ideologies of the other two systems that we talked about, being that illness is related to any kind of supernatural or natural balance type of ideology, but basically, um, you know, focuses on the scientific explanation rather than anything else. The cause of illness in the scientific biomedical tradition is basically an abnormality in the body's physical structure or its chemical functioning. All right, so we treat illness in the supernatural, I'm sorry, in the biomedical, scientific biomedical tradition by using chemical or natural medicines, surgeries, and other invasive or non-invasive procedures that are meant to try to remove or destroy what is ever physically causing the illness by fixing chemical imbalances or by somehow or another, either through chemistry or through physical intervention, try to bring the body back to its normal functioning. Now, it's important to remember and to understand that these three healthcare belief systems are not exclusive of one another. People of all cultures, most people of all cultures, will follow more than one of these healthcare belief systems at the same time. Let's take a look at some examples of that. In the United States, it's very common for people to employ both spiritual and holistic methods of preventative medicine, such as meditation, probiotics, herbal supplements, massage, um, and and going to people like chiropractors, acupuncturists. These are holistic types of medications. Where it's very common for us to do that is actually quite a large industry. But at the same time, the majority of people here in the United States, if they're really sick, they're going to maybe take a Tylenol when they have a headache, or go to the doctor when they're vomiting uncontrollably. Or if they break their arm, they're not likely to go to the acupuncturist. They're probably going to go to the emergency room, right? So even though we engage in those types of holistic or spiritual preventative medications, we're still going to go to the doctor or to the hospital whenever we're ill and the need calls for it. Once we're there, we're going to not just engage and put all of our faith into the medical system. In many cases, we also elicit help from spiritual healers also through Catholic healing services, through prayer vigils, prayer chains. Our religious organizations all have social supports and religious supports set up, and that who will attempt to elicit help from whatever uh, deity or spiritual being that you believe in that is capable of helping you to help you get well. But that doesn't mean you're not going to leave the hospital. You're going to stay in the hospital and you're going to receive treatment at the same time you're receiving these spiritual helps. Another good example, when you go to the hospital, most of, or I won't say most, but many of your doctors are going to be Muslim. It is considered to be a great honor to be a doctor in many Muslim countries. These cultures look at the biomedical tradition with great respect and give it a great deference. But at the same time, just like many other people here in the United States, we're going to see that when somebody gets ill, they're going to often pray for that person's recovery. They're going to maybe uh, recite Quranic verses, and not just when a person is ill, but also to prevent any kind of illness. If somebody is going to have a baby, or possibly maybe even going in to have some kind of procedure, whether it be a serious procedure or a simple procedure, but they're going to ask God for help and protection. But at the same time, still be putting their faith in their doctors. More examples here. I'm not going to go through them all, but one I'll point out here, that Buddhists in China and Japan, if you go to any Asian country, particularly China or Japan, you go to a Buddhist temple, you're going to see they're going to have amulets for sale. And if you go and you look at the amulets, some will be for success, some will be for happiness, some will be for love, some will be for health. Uh, they will buy these amulets for themselves or for others in order to ward off any kind of evil or bad things to happen to them, or perhaps even promote healing or success for that individual. But at the same time, they're like, like most other people, they're going to go to the hospital when they're sick, and they have some of the best hospitals in the world. Um, Now that said, not everybody will go to the scientific biomedical tradition and along with their other traditions. Some people will adhere to either the holistic or the supernatural Magico religious tradition exclusively of the scientific biomedical tradition, and may refuse treatment because they feel that illnesses cannot or should not be prevented or treated by extrinsic human measures. And a good example of this is your Christian Scientists. They often refuse treatment because they feel that either God will make you well or it's not meant to be. Okay, so we're going to kind of switch gears here a little bit, and we're going to talk about some skills that are needed to interact appropriately in a situation where you have a patient and a healthcare provider. Well, we're going to be using terminology that is specific to the healthcare setting, and maybe even talking about some situations that are specific to the healthcare setting. I want you to keep in mind that many of the tips and the skills that we're going to be discussing are applicable outside of the healthcare setting as well, to pretty much any type of situation where you have a provider of some type of service speaking to a client. In fact, many of these same skills, these same tips, I use when I talk to attorneys in continuing legal education about intercultural communication with their clients. I've used this same information in discussions with financial planners as well. So much of this is applicable beyond just the scope that we're going to be discussing it in. So first we need to talk about what is intercultural competence. Intercultural competence is generally defined as the knowledge, motivation, and skills to interact effectively and appropriately with members of different cultures. So how do we develop this intercultural or this intercultural competence? First of all, you need to know yourself. That's my big saying, right? Uh, if you want to know somebody else before you can understand somebody else, you have to first understand yourself. In order to understand what motivates another person and why that person is motivated by that thing, you need to understand why you are motivated by things. All right? What motivates you? Why do you believe what you believe? Is it because you learned it from your family? Is it because you learned it from your church? Is it because of certain experiences that you've had, or maybe that you heard from other family members? Why do you believe what you believe? What motivates you? If you understand these things, you're going to be able to understand somebody else a little bit better. If you understand, or if what motivates you because you learned it as a child, then you'll understand that what somebody else learned as a child, even if that may be different than what you learned, is going to motivate them as well. So you understand why things are important to them. So you must know yourself thoroughly before you can really peer into somebody else and try to feel what they're feeling and why they feel how they do about certain things. And then you need to gain the knowledge. Study and become familiar with the cultures that you're going to encounter or are likely to encounter in your practice. So if you know that you're going to be practicing in a community that has a demographic of Chinese people, you're going to want to learn a little bit more about the Chinese culture. If you know that you have a large number of Hispanics in your area, you're going to want to learn a little bit more about their cultures. It's not, however, enough to just know about the cultures. Knowing the information is the first step, but it's not enough in and of itself. You need to learn how to be able to show respect for and even attempt to accommodate other ways of doing things, even if you don't agree with them. In a situation where you are a provider and you have either a client or a patient, you have to bend to that client or patient as the provider. That is your job. You will not be able to provide a proper service unless you can do so. So you need to be able to show that you respect their traditions, show that you respect their beliefs, and even in some cases when you are able to uh, try to accommodate their ways of doing things, even if that's not the way you would particularly choose to do something, or even if it's not something you agree with. And the one big and the reason for this, particularly in the healthcare setting, is that if, as a healthcare provider, you are providing a service to an individual who does not believe in your service, then that person is not likely to respond well physically to the treatment that you are providing to them. You cannot discount the effect of the psyche on a person's physical well-being. No matter how good your prescribed treatment is, it will likely be unsuccessful, either because the patient doesn't follow through with what you tell them to do, or perhaps just because they just don't believe in it. The effect of the psyche on a person's physical well-being is significant and irrefutable. So let's take a look at some of the attributes of an interculturally competent healthcare system. So when you have a healthcare system, whether it be a doctor's office or a hospital, whatever, if you want it to be an interculturally competent system and while working within multiple cultural diversities, you want to have a staff that reflects the culture served. So again, if you know that you have a large amount of Hispanic patients, you may want to have some staff who resemble that, or so Asians or Middle Easterners. You want to have a staff that reflects the cultures being served. When they go to that doctor's office or they go to that hospital and they see faces that look like theirs, or they hear people speaking their language, they're going to feel more comfortable. They're going to feel more respected. And they're going to be able to then have a better attitude toward their treatment there. We want to have providers and interpreters who speak the patient's language. That's extremely important. We're going to be talking more later on in this section about language barriers. We want to have also training for providers about the culture and the language of the people they serve. Uh, I am asking you to watch this week a video that I had made once when I had a member of the public relations group from UPMC come and talk to the class. She talked about a lot of things that UPMC does in order to make themselves a more interculturally interculturally competent healthcare system. And one of the things that she talks about is the training that they provide to their staff about the cultures and the languages of the people around them. Also, it's a good idea to have signage and instructional literature in the patient's languages and that is consistent with their norms. So you want to have, as much as you can, you want to have uh, pamphlets that are in Chinese or Spanish or whatever you're likely to come in contact there. Many places now have signage that has multiple languages on it, whether it be welcome or exit or something, especially if it's really important for people to understand this particular direction. They're going to have something in those person's language so that they can read it and feel more comfortable and be more knowledgeable. Also important is culturally specific healthcare settings. Now, the lady from UPMC also talks about this as well, where they had to provide certain types of settings to accommodate the cultures that were uh, experiencing certain needs or concerns within their hospital. For example, the example that she uses is during Eid, when at Children's Hospital, when parents were there visiting their children or spending time with their ill children at a time when religiously they would normally be at home celebrating, having big dinners with family, in much the same way that Christians are familiar with spending Christmas or or Easter. So they were able to provide them a space in which the Muslim families there could get together and have a meal, and just spend time together and maybe say a prayer together, and be able to enjoy their holiday, or at least acknowledge their holiday even though they were in the hospital. All right, some barriers to effective communication in the healthcare setting are kind of basic, the same types of barriers that we would see anywhere, such as language differences, lack of knowledge, cultural knowledge about the people that you're working with, or racism, ethnocentrism, biases, prejudices. Those things are, of course, always going to be barriers to any type of intercultural communication. But some things that are you know, uh, really prevalent here in the healthcare setting is patient fear and distrust of caregivers. Now, this is going to be prevalent because people who have had experiences in the past, or who have known people who've had experiences in the past where perhaps maybe their cultural beliefs were not given respect by the healthcare provider. Now, we talked about earlier how the scientific biomedical tradition generally tends to kind of poo poo off the ideas of the supernatural Majika religious tradition or the holistic tradition. I've had so many doctors tell me that chiropractors are quacks, never go to a chiropractor, things like that. They just don't seem to give the respect to those types of medical or healthcare belief systems. And so, as a result, many patients who go to the doctors are reluctant to discuss their other healthcare beliefs with the doctors, that anything outside of the scientific biomedical tradition. And as a result, they are concerned. They don't trust their caregivers to be able to understand, or to give them respect. As to why they feel they're sick or what they feel they needs to be done, and they won't maybe communicate appropriately or communicate everything they need to communicate with their caregivers. We also have differences in perceptions and expectations. And while this is going to be true in any intercultural communications situation, it's particularly true when we're talking about a situation where we have a client or patient and a provider. Certain providers are going to be looked at, culturally speaking, in different ways. Some patient have may and So patients in different cultures are going to have different expectations of their doctors, how they should behave, how they should speak, what their role is, all right, what they should do, how much time they should spend with the patient. Some are going to expect that to be minimal. Some of them are going to expect that to be a lot. So, you're going to want to know what is perceived of you, what is expected of you, so that you can kind of conform to the expectations. If you expect it to be formal and aloof, be a little bit more formal and aloof. Don't just sit down, slap people in the back, and tell jokes. Okay. If you are expected to be more personable, then you want to be more personable. Spend a little more time. But if you don't if you don't conform to the expectations of the client patient, then that person is going to lose faith in you and not going to follow your treatment, and therefore that treatment will not be successful. All right, so let's look at some strategies to overcome all these barriers. First of all, we want to remember the platinum rule, right? As opposed to the golden rule where we treat others the way we would like to be treated, we want to treat others the way they would like to be treated. The definition of good treatment is going to be different, and the expectations of how you want to be treated are going to differ from culture to culture. So you want to remember that what you think might be a good way to be treated, the way you would like your doctor to talk to you, might not be the same way that somebody else from a different culture will want to have their doctor talk to them. You want to be be sure that you're understanding what they need and what they want, and be able to conform to what the client patient needs. Okay, because again, as a provider, you're meant to conform to your client patient, rather than in like in a social setting where you might want to bend to each other. Really, the provider is expected to be what the client patient needs. You want to begin an interaction with being more formal than informal. We have a tendency here in the United States, as we've said before, to be a very informal culture. So and also a low power distance culture. So oftentimes, in order to make a client, or in order to make a patient or even a client in a non-healthcare situation feel more at ease, a provider will generally go into that conversation and try to make that person feel better by telling jokes or talking about personal preferences or things, or what they did for holiday or where they went, and you know uh, just to try and relax somebody. But not all cultures are going to want to have that in this type of situation. Many cultures are going to look to the doctor, or to the provider, as somebody who has a higher education, as somebody who has a specific highly educated role to play, and therefore they're not going to want that person to be somebody who is just like them, or who is just kind of buddy buddy with them. They're going to want somebody who is more formal, respectful, of course, but maybe more formal, maybe more to the point, maybe more acting more academic. So you want to start out with being more formal than you would normally be, necessarily, until you know the person that you're talking to. As you get to know your patient, you may see that they feel uncomfortable with your formality, in which case then you can become a little bit more informal and see if that helps out a little bit. But it's always best to start more formally, because most cultures tend to have more formal expectations than our culture does. Make sure that you let your patients know it is okay to seek alternative care along with your treatment. All right, so if they are coming to you for scientific biomedical treatment, they need to know that it is okay for them to pursue other types of treatment as well, whether that be holistic treatment or more spiritual types of treatment, but that you need to know what these things are, so that you don't make conflicting treatments that could end up being harmful. Sometimes people will often engage in holistic treatments, thinking that they wouldn't interact with the biomedical treatment, but in fact they do. A good example of this is the use of grapefruits with statins. Um, Statins, as many of you probably know, are cholesterol lowering drugs, and they can be very good drugs. But there are a lot of interactions that can occur with statins that can actually make them, very dangerous, even fatal. And when you eat grapefruit, which is a cholesterol lowering fruit, along with this cholesterol lowering chemical medication, sometimes what you can do is end up lowering your good cholesterol too much, so that it can be you can have a negative it can have a negative effect. So doctors need to know, uh, if you are planning to take or are eating a grapefruit regimen, so that they can adjust your statins appropriately. They need to know these things, and many patients don't think to share this, or are afraid to share this, because they think that the doctor is going to be upset with them for for doing things outside of the scientific biomedical tradition. It's also extremely important to make sure that you do not discount the possible effects of the supernatural on the patient's health. Whether you believe it personally or not, your patient does believe it. So, whatever supernatural um, belief that they have, whatever deity they think that they pray to, or that they think may be affecting their life, or whether they feel that maybe there are evil spirits affecting them, which is why they're sick, whatever. No matter whether you agree with it or you don't agree with it, what your feelings about this supernatural force do not matter. All that matters is what your patient's feelings about this supernatural force is. If a patient believes that they're if they believe that the cause or the treatment of their illness is other than what you are prescribing to them, then that can affect their behavior towards your treatment. They may or may not fully comply with what you're doing, and you may not even know that they're not complying. Also, is just again the effect of the psyche on the physical. If you are saying, that telling them that their beliefs are ridiculous, they're not going to respect you. If you don't respect their beliefs, they're not going to respect your treatment, and they're not going to follow your treatments, and therefore your treatments are going to be unsuccessful. If they feel that they're doing everything psychologically, both through the biomedical scientific tradition and also through their supernatural magical religious traditions, then they're going to feel more confident. They're going to feel maybe more peaceful, and that that effect of the mental the mental effect of their psyche on their physical well-being is going to help your treatment be able to succeed as well. So you don't want to discount the effects of the supernatural on the patient's health. Whether or not you believe a particular spiritual deity is actually affecting that individual doesn't matter. What matters is that they believe it, and therefore you must believe it as well, or at least you must be able to accommodate that belief when choosing your treatment plan. While it is really important for you to be able to understand or to know what a patient may be doing outside of your treatment plan, you need to be careful about the way that you approach that question. Again, remember we talked about before that a lot of patients have a fear or distrust of caregivers simply because they've either had bad experiences before where caregivers were disrespectful of their beliefs, or you know just kind of gave them a hard time for maybe doing things outside of the biomedical tradition. So they may not want to share that information with you. So you need to be very careful about how you ask for that information by really trying to let them know that it is okay for them to do that and okay for them to share that information with you. So you want to ask in such a way that shows your interest in what they're doing and the fact that you are okay with that person. Like, for example, I have a couple examples up here. Like, I know some persons from your culture visit shaman. Do you? Or I think that this is really common, and I think this is really cool. Can you tell me a little bit more about how this works in your culture? I haven't really been able to experience it, but I'd really like to see it for myself. Can you tell me more about it? Have you tried something like that? I know it's common for you to do certain things. What are your feelings about that? For people in your culture to try different foods, or maybe do you have a concern about when your surgery is? Do you want the earliest available, or do you want to talk to somebody and come back to me and tell me when is a good time for you, and we'll try to schedule it. You want to ask things like that by showing interest, showing respect. Don't just come out and say, uh, you know, I know that some people in your culture do something like that. Have you done it? Because I don't really like that. Or you just have you done it? You don't want to just say that, because then um, they're going to feel confronted, right? And they're going to not be really sure that it's okay for them to tell you that information. And they may say no when in actuality they are doing it. And then you might prescribe a treatment plan that either they're not going to follow or could be in conflict with what they're doing. You can never try to force or demand a person to change their beliefs or to comply with what you have prescribed for them. If if you prescribe something for them that they simply will not follow because of their religious beliefs or their confidence in the holistic tradition, this may be very frustrating to you because you know what the best course of action is and you want to do your best for that particular patient or client, and you can't do what you know is best because they aren't interested in pursuing that particular course. So you need to try to negotiate a plan that both of you can live with. And that can be tough for a provider, knowing that they could do better, but maybe having to back off of what they think is the best way in order to find another way that maybe won't have the same results, or maybe not as good of results or good of a chance of results that you would like, but will at least ensure that your patient or your client is going to comply with what you want them to comply with, is going to be confident in that treatment plan. You want to be careful when constructing your messages, right? Employ empathy. Remember that when you are talking to somebody, particularly in the healthcare setting, this is somebody who is sick, somebody who may be very scared, especially if they have a very serious illness. They may not be thinking or behaving as rationally as they normally would, and much the same way as the my husband's ex-husband's cousin, when I talked to you about the evil eye situation. That would not necessarily be her normal behavior, her normal thought process, but because she was sick and scared, it was. All right, so these are people who are not necessarily at their best. And you want to employ empathy for that situation. So not only are we talking to somebody who may be of a different cultural mindset, we're talking about to somebody who is of a different cultural mindset and also not at their best. So in that case, we're going to have to be extra compliant or extra concerned, extra willing to adapt to them and what they need and what makes them feel better about the situation. Be careful when relating bad news. All right. Know the culture before you relate any bad news to a patient. In the American ideal, we believe that the patient is in charge of their own health care, right? That it is the patient who should know everything about their condition, um, who should make the decisions about their treatments. But that's not the case in all cultures. In some cultures, family members will decide what and how much to tell the patient, and then they will make the medical decisions on the patient's behalf. Now, that's tough for us, even legally speaking, right? Because we have laws about uh, what we need to have in place in order for somebody else to make a decision for a patient when it comes to their particular health care. Um, so it's difficult for us to understand this, but it's very true. If you do not understand the way that they do things, and you try to circumvent the family by telling the patient directly things that um, would not be what the patient may normally need to know or make decisions on, you're going to alienate the family members upon whom the patient is going to be relying in order to, for decision making, for uh, advice. But you're also going to be stressing the patient in ways that they may not be able to handle. Let me give you an example. My mother-in-law was a liver transplant patient. So she was very ill for many, many years, and we spent a lot of time going to doctors, and there were some very important medical decisions that needed to be made. Now, in the Pakistani culture, female family members aren't always the ones making choices, particularly the older generations, not so much in the newer generations, but particularly in her generation. It wasn't really her role to make the choices for her medical care. And it was more the choice of the family. She would look to the family to decide what she should do. She may be aware of it, or she may not be aware of it. And for the most part, they kept her aware of things, but there were certain things that they did not tell her about, and that bothered me. As part of that family, that bothered me a lot as an American. I felt that she really needed to know all of this information. But I pushed them. I told them they should be telling her these things. They shouldn't be hiding things from her. They shouldn't be hiding the severity of the situation from her. And I was wrong. All right. Thank God they did not heed my pushing, because they were right and I was wrong. She would not have been able to handle it psychologically. It she she would not have been able to handle the extra stress of knowing the full situation. She wouldn't have understood it anyway, and it just would have stressed her out more, which would have held her back from her recovery even longer. So going through the family was the right thing for her. She would never have done anything that the family didn't tell her what to do anyway. So by telling her these things, by circumventing the family and going straight to her, you would not have accomplished anything except to stress her out and to upset the family members. So, in other words, I wasn't helping anyone by pushing that she should have certain knowledge. Um, I should wasn't helping her by trying to circumvent her culture to push people to give her information that she wasn't able to handle. All right, they know their ways of doing things. They know what's right for them. Do not try to impose our American ideals on them. Now, that said, I am an attorney, right? So I want to warn you that while it is important as a medical provider to keep in mind the needs of the family culturally, as we just said, but you also need to keep an eye on the law as well. And in many cases, our law does not allow anyone other than the patient to make certain decisions. And we must have informed consent of the patient for any medical procedures that we do, especially when we have a patient who is not incompetent, right? So if we're in a situation like this, we need to make sure that you have the right legal paperwork in place in order to speak to family members about the patient's condition, with or without the patient's consent. You need to make sure that you have the right paperwork in place in order to accept the decisions of anyone other than the patient. Should things come to that, you need to be able to have that paperwork in place. So you want to make sure that when you start treating somebody in a situation like this, that you are asking them to give you the power of attorneys that you need, particularly the healthcare powers of attorneys that you need in order to be able to include the family in those decisions. So overall, we want to make use of what we call the LEARN model, and as you can see, that's an acronym for these 5 steps. First of all, L, listen and ask questions to learn how the patient perceives his or her illness and its cause. E, explain fully and in simple terms what the patient needs to know about the illness and its treatment. A, acknowledge and value medical views that differ from your own. R, recommend, don't demand, what the patient should do and help them practice doing it to confirm understanding. And N, negotiate with the patient to find a treatment plan that is acceptable to both cultures. Okay, so let's now talk about the most important or the most significant barrier to intercultural communication, and that is language. When language barriers are present in an intercultural communication, that can become one of the most difficult barriers to that communication because it is hard for one person to understand or communicate their thoughts and feelings to the other. So in a light healthcare type of situation, that situation or that barrier can actually become a life-threatening type of situation, as we've discussed previously. Even if the patient speaks some English, they may not be fluent enough in the language to understand medical jargon or slang. You want to make sure that when you are speaking to them that they are understanding you. So you want to make sure you keep it simple and remember that you may not be getting the full story from them. You may be only getting vague descriptions of the symptoms because not because they're trying to deceive you, but because they don't know the words to explain their symptoms properly or their situation properly. So therefore, when you're dealing with a language barrier, you want to make sure that you assume that there's always more to the story than you're getting until you are able, by means of tests or whatever, to rule out any situation. It's always best when, unless you are completely fluent in their language or they are completely fluent in your language, that you try to use an interpreter. A trained medical interpreter is always the best way to go if that is available for you. If you do not have a trained medical interpreter available, then you need to make sure that you are minimizing the possible problems and using friends or family members as interpreters, which is done often but can have a lot of issues attached to it. First of all, non-professional interpreters are not necessarily going to know how to translate medical terminology or the names of medications. So there may be some information that they may understand but not know how to translate that so that the patient can understand it, whereas a trained medical provider would know that information. Also, there are sensitive medical concerns that may not be able to be conveyed from the patient to the caregiver through an interpreter if that interpreter is a friend or a family member or a member of the opposite gender. Things that you know things that they want to tell you that you need to know that they may not feel comfortable saying, like for example, if they're being sexually abused at home or physically abused, they're not necessarily going to be able to tell you that through their children or through their spouses. They or even maybe through their friends, they may be too embarrassed to talk about things like that. Or maybe if you've got an elderly mother coming in with her son or daughter, she may be having sexual concerns, or she may be having uh, you know uh, concerns that are more uh, attributed to her gender that she doesn't feel comfortable talking about through her son or daughter. Um, Also, you may have privacy concerns. Whenever we're talking to somebody who is not a healthcare professional, even if, as a healthcare professional interpreter, or who is not the patient, we have concerns about privacy issues. So if you're going to be using a family member or a friend as an interpreter, you want to make sure that you have a signed consent form from the patient prior to speaking through that interpreter. Always cover yourself, always protect yourself from any leakage of privacy issues that could come back to hurt you later on. All right, so when we conduct our interviews, we have to make sure that we are conducting interviews that are effective and considerate of the language barrier. Patient interviews are extremely important, and this is true for not just the healthcare setting, but for any kind of client patient or client provider type of setting as well, for attorneys or for accountants or financial planners. The first initial interview is where you learn who that person is, what their needs are, and what they need you to do for them. So it is extremely important to make sure that communication is effective, that you understand everything they're trying to tell you, and that they understand everything you're trying to tell them. Of course, in the healthcare setting, that's even more important because this is when the first treatment and diagnosis begins. All right. So if you get it wrong, if the interview is ineffective, that's going to cause you to maybe misdiagnose the patient, to delay their treatment, that or at least give, or maybe even give them the wrong treatment to begin with, and possibly even cause you to have to run a bunch of expensive and inconvenient tests that are not necessary because that's not what the person is experiencing. So let's see what we can do. Look at some recommendations in order to make our medical interview more successful. First of all, again, always use an interpreter unless you are fluent in the patient's language for the reasons that we just discussed. Also, for the reasons that we just discussed, to try to use an interpreter of the same gender and try to avoid using a family member as an interpreter. Learn basic words in the patient's language. Just like we said in the business and professional section, just like in that section, you don't have to be fluent necessarily in your partner's language, but you can learn certain things like greetings and partings in order to make them feel more comfortable. You can do that in the healthcare setting as well, not just to make them feel more comfortable, but also to help the situation go a little faster, particularly if you don't have an interpreter, if you have somebody who has limited English skills. You can learn things like hand up, or rather arm up, or leg down, or tongue out. All right, simple things like that that can maybe help an examination go along a little bit more smoothly and make the patient feel more respected and comfortable with you. Make sure that you speak slowly and that you repeat yourself often, especially if there's somebody who has a little bit of English but maybe isn't completely fluent. They're going to need that in order to understand because they may not catch everything the first time through. Make sure that if a person doesn't understand you because of a language barrier, you are not repeating the same thing over again in the same way. If they didn't understand it the first time, they're not going to understand it the second time. And we have a tendency to do that. If someone doesn't understand us, we repeat the same thing again in the same way. And we often will say it louder, right? Because we assume that for some reason they didn't hear us. If they didn't understand us, they didn't hear us. These people aren't deaf. They just have language barriers. So saying the same thing in the same way isn't going to help. No matter how many times my mother-in-law says things to me in Italian, I still don't understand them. Every time she tells me something in Italian, I say, "I'm sorry, I don't understand." She'll tell me the same thing exactly the same way, and she'll raise her voice, and I still don't understand because I don't understand the words, not because I'm deaf. So you want to make sure that you are not falling into that trap. It's something that we know consciously. We all know that consciously, but uh, unconsciously we always tend to fall into that trap. You want to repeat yourself but use different words, use different phrases. If they didn't understand the words you used the first time, they may understand a different set of words. Be patient. Understanding is going to require a great deal more explanation than when you are speaking with somebody who is fluent in your language. Even if you're using an interpreter, it's going to take more time because the interpreter is going to have to repeat everything that either you or the patient says. So you want to make sure that you've allotted enough time that you can spend a little bit more time with this patient so that you're not in a rush. You can be patient and take the time that you need to get the explanation and the responses that you need. Don't remember, you may not be getting the correct response the first time that you ask. You may have to ask a question more than one time to see if you get the same answer each time in order to understand whether or not it is the correct answer. When you are using an interpreter, do not ignore the patient um, as if they're not there. A lot of us, because we have that concept that we have to keep eye contact with the person that we're speaking, will often look at the interpreter when we are speaking because we feel the interpreter is the one to whom we are addressing our comments, and then the interpreter will talk to the patient. But the interpreter is just there as a tool for us and for our conversation, not to be a part of the conversation, particularly if they are a trained medical interpreter. They're just there as a tool. So you can kind of ignore them a little bit, but make sure that you're focusing on the patient. Look at the patient when you're speaking, not at the interpreter. And look at the patient when the interpreter is telling you what the patient said, because it's the interpreter or it's the patient's words that you're hearing, not the interpreter's words. If you suspect that you have received an incorrect answer to a question, and what do I mean by that? If somebody comes in and their foot is like 2 times the size it's supposed to be and all black and blue, and you ask, does it hurt? And they say no, that could be true. There could be nerve damage. You don't know that for sure, but that's not the expected answer. So before you diagnose nerve damage, you might want to make sure that the interpreter is really understanding what you're asking that person. Rephrase it. Maybe ask the interpreter, tell the interpreter exactly what information you need, rather than just asking the question in a different way. Tell them what I'm trying to get at with this question so that they can decide what is the best way to phrase that question so that you get the information that you need. Make sure that you try to avoid technical and professional jargon. These things are difficult to translate, and even a professional interpreter isn't always going to know how to translate all of this. Some of these things won't have translations, and even if you're speaking to someone who is fluent in English, they may not understand technical and professional jargon because they're not a part of the medical profession. So you want to try to avoid that as much as possible. Try to use short questions and comments. Anytime time that you really just get into long explanations, that's going to make it more complicated for the patient to understand, or somebody with a language barrier to understand. So you want to try to keep it as brief as possible. Try to use easy phrases and words that can be translated easily. Using metaphors and similes that makes it difficult for the interpreter. They may understand it and be able to interpret it, but depending upon their level of interpretive capabilities, particularly if you're not working with a professional interpreter, that's going to be really difficult for them to translate. So try to avoid using those types of language uh, uh, aspects. Think about what you say before you say it. All right. You don't want to, we have a tendency in the US to make decisions through what we call brainstorming, right? So we get a little bit of information and then we just kind of veer off somewhere and think about that and ask another question. It's like, oh, that makes us think about this. And then we're going to ask about that question. And then and we're all over the board, right? It makes sense in our minds and our heads, but it's not going to be able to be followed by the person that we're speaking to. The interpreter or the patient isn't going to be able to understand your thought processes. And you may be getting inconsistent information. You may not be getting full amounts of information because you're kind of asking questions that are just going off in different tangents. You want to make sure that you're asking questions that are methodical, that are well thought through, so that you're getting information in the correct order and that you're getting information that is going to, or you're asking questions that's going to give you a full understanding of the situation, um, from the patient in a way that they're given the opportunity to tell their whole story, right, and give all the information that you need for you. Sometimes this is going to mean that you're going to need to meet with the patient more than once. Sometimes that means that you're going to have to get preliminary information and take that preliminary information back. Say, okay, I'm going to meet with you again in a couple of days. Think about that preliminary information, decide what your next set of questions are going to be, and go back to the patient with the next set of questions. And sometimes that's just going to be really important for you to get the full information and make sure that your decisions are correct the first time. Some sample questions that you might ask in an intercultural medical interview. What do you call the illness? What do you think caused the illness? Why do you believe the illness started when it did? How severe is the illness? Now, again, these are all things that are going toward those medical or those healthcare belief systems, right? Trying to understand what that person's healthcare beliefs systems or healthcare beliefs are, and what they think is wrong with them and what they need you to do about it. Uh, Again, the next question, what kind of treatment do you think is necessary? So again, going toward the trying to determine healthcare beliefs, right? But that particular question is one that you need to approach with great caution. Just like in the business setting we talked about with manager and employee relations, questions like this could cause some patients to lose faith in you. They feel that you're the doctor. Why are you asking them? Right? Just like we said with some manager employee relationships where managers telling the employees, you're like, well, what do you think we should do? It's just like in that situation in the video that you watched, where with the Indian uh, employee and the American manager when he thought, well, you make the decision, it's your department. Same thing like that. If a doctor asks you, well, what do you think I should do? That's important for you to know, right? That kind of information because it's going toward that healthcare belief system knowledge. But if you ask that directly, some people, particularly people from high power distance cultures, they're going to look at that and they're going to be thinking like, dude, that's why I'm here, right? I'm here for you to tell me what it is I need to do or what it is that is necessary for me to get better. Even people from the low power distance cultures may have a problem with that. So you want to be careful and make sure that you don't quite phrase it exactly like that and try to be a little bit more roundabout with that question. What are the most important results you would hope to receive from this treatment? Again, that's really important. If you want to know what that person needs from you and expecting from you so that you can try to meet those expectations. What are the main problems the illness has caused you? What do you fear most from the illness? What treatments, if any, are you receiving or have you received? And are you using or have you used folk remedies? Again, very important for the reasons we've already discussed, but also a tricky question. You need to be careful about how you ask that and make sure that your patients know that they can be honest and open with you about everything that they believe and have done or are planning to do. Finally, let's talk a little bit about death and dying. As we've talked about in the previous chapters, different cultures have different ways of dealing with death and approaching death. And you need to be knowledgeable and sensitive to those ways. What is necessary to disclose, or when it is necessary to disclose information about a death or a terminal illness to to a patient or to the family members, you need to be aware of family roles in just the way that we talked about when we were talking about relaying bad information. This is like with the ultimate bad information, right? You need to be careful not only of understanding family roles, but also understanding the cultural attitudes toward death. Uh, that kind of information may be detrimental to the patient. Maybe needs to go to the patient may need to know about it, but it may needs to come through to the patient through a family member rather than from the healthcare professional. Make sure you understand the cultural rules with regard to that. Make sure you understand your patient and their needs and their desires and how they view their family's role in their medical treatment when you are approaching something like this. If you have, of course, made sure that you have the proper legal documents in place, it may be best to talk to the family members before you talk to the patient in some cases, in some cultures. You need to make sure that you are taking the initiative to learn about cultural views of death and dying before entering into questions such as what if, all right? What if the worst happens and you die on the table? Or what if something happens and you are not able to recover appropriately or whatever, but when you enter into these types of what if types of situation or questions, you need to be aware of the possible cultural attitudes toward um, discussing the worst or the possibilities, negative possibilities prior to going into a surgery or a situation. Some cultures have superstitions that would basically, they would feel like that basically jinx the situation, so they may not get a treatment that they absolutely need because you have discussed these possibilities ahead of time, even if, and it's our law to do so, right? We must discuss these possibilities ahead of time. It's called informed consent. They must know these things. They must consent to it. They must have a what if plan in place. Anytime that you go in, even for a simple uh, outpatient procedure, they're going to ask you about whether or not you have an advance directive or a living will. The medical profession calls it an advance directive. The legal profession calls it a living will, but it's the same thing. They want to know where their direction is going to be coming from and what it is they're expected to do in the worst case scenario, however unlikely that scenario may be. But that can actually cause people in some cultures to not pursue uh, a very needed medical procedure. So it's kind of, in this case, a really difficult balancing act to try and avoid scaring them out of this procedure while at the same time covering yourself legally with the information that needs to be divulged to them. So you want to be very careful about how you approach these types of what if questions. You do have to approach them, you can't just ignore them, but you need to be very understanding of uh, potential issues that might arise from the way you phrase things about, maybe start into this is not likely, but that the type of situation. You need to be careful about how you phrase those kinds of questions. All right, so basically, when we're talking about any type of intercultural communication in uh, a provider, client, patient type of situation, we're talking about a situation in which the provider needs to be very considerate of the client patient's cultural needs, more so than in many other types of situations, like a business partnership where your things are maybe a little bit more equalized and each person is going to be bending toward each other. This is more one-sided. It is more the provider bending toward the client patient than it is the client or patient bending toward the provider, because it is the provider who is providing a service. And it's the provider who needs to provide the best service possible. And in order to do that, you need to be able to understand what that person expects of you, what that person needs of you, and what that person is experiencing. And you're not going to be able to understand that unless you do things their way. So, in the healthcare setting, in other types of uh, provider settings, you need to make sure that you are employing the tools that we talked about in this particular section of Chapter 10 if you want to have an effective practice with your diverse clients.